Hyperbaric therapy is generally a very safe therapy with very few side effects that occur. And good news that most of these side effects, if not all, are preventable. In this video, I'll walk you through most common, not so common, and rare side effects to hyperbaric therapy, and I will share my tips on how to prevent those side effects from happening so you can enjoy your hyperbaric treatments, get the most benefits from hyperbaric treatments without experiencing any unwanted adverse reactions. The most common side effect to hyperbaric is barotrauma, which is an injury because of the change in pressure. Barotrauma occurs when the pressure inside the air-filled cavities in our body is not equalized within the pressure in the environment. So ear-filled cavities are, for example, ear, because we have air in the ear, or sinuses. When we increase the pressure inside a hyperbaric chamber, we need to equalize the pressure in our ears and sinuses with the pressure in our environment. I have a great video that explains step by step how to do it. The important part that it needs to be done always during pressurization phase of hyperbaric treatment. If a person is congested, if they have a flu, an infection, and they can't equalize the pressure, they might experience pain. If this is happening, stop pressurization, bring the pressure down to the comfortable level, and try to equalize the pressure in the ears with the environmental pressure to feel that the eustachian tube, which connects your nose and your ear, opens and allows the air influx into the ear, and that way the pressure is being equalized. If pressurization continues despite a lot of pressure and pain felt in the ear, it can lead to trauma, even to the rupture of tympanic membrane, and sometimes that trauma goes to inner ear and the person starts to experience a lot of vertigo. We don't want that to happen. In order to prevent it, make sure that you keep equalizing pressure in your ears with the increasing pressure inside a hyperbaric chamber every 30-45 seconds during pressurization. And sometimes during depressurization, if you feel a little congested and if you feel that the pressure is not equalized. Our next side effect to hyperbaric therapy is quite rare. It's oxygen toxicity, which is due to the increased reactive oxygen species. Oxygen toxicity can be distinguished between pulmonary oxygen toxicity that occurs at the level of the lungs and central nervous system oxygen toxicity. Nervous system is very sensitive to increased oxygen and to increased amount of reactive oxygen species. Luckily, central nervous system oxygen toxicity doesn't occur at pressures lower than 2 atmospheres inside a hyperbaric chamber. So if you're not doing treatments at pressure higher than 2 ATA, you should not be concerned with central nervous system oxygen toxicity. It happens quite fast. It's quite scary actually when you see it, but it's absolutely reversible. We'd like to avoid this excessive neuroexcitability that happens at the higher level of partial pressure of oxygen. This is one of the reasons why hyperbaric sessions for a neurological condition are usually kept below 2 ATA to avoid this excessive neuroexcitability. Pulmonary oxygen toxicity is even more rare than central nervous system oxygen toxicity is very rare. It's 1 per every 50,000 treatments, not people, treatments. Pulmonary oxygen toxicity is due to prolonged exposure to oxygen, to increased partial pressure of oxygen. It happens if we are doing treatments at 2 ATA with 100% oxygen. We see the first signs of pulmonary oxygen toxicity after 3 to 6 hours. And at pressure of 1.5 ATA, we see the symptoms, the first symptoms of pulmonary oxygen toxicity after 16 hours of continuous exposure. This is very important to understand. If you're not staying inside a hyperbaric chamber for 16 hours at a time at 1.5 ATA with 100% oxygen, you should not be concerned with pulmonary oxygen toxicity. Both oxygen toxicities are quite rare, but they need to be watched for, especially if we're doing long hyperbaric treatments like for decompression sickness or conditions like that. Side effects to hyperbaric therapy can occur at ocular level. Ocular means eye, so we can get myopia and cataract maturation. Let's look at both side effects in more detail. Myopia, which is a nearsightedness, occurs when somebody is getting a lot of hyperbaric treatments, let's say more than 100 treatments, and it's reversible, which means when somebody stops their hyperbaric therapy, their eyesight will return to baseline. Usually it happens in 3 to 6 weeks, but in some people, they're older individual, if they have some comorbidities, so other conditions that might influence the health of their eyes, so it might take 6 to 12 months to get to your baseline, to where the vision was before you started hyperbaric treatments. Cataract maturation happens mostly in the elderly population and somebody who's had a cataract before they started hyperbaric treatment. Then they got more than 100 treatments, we see cataract maturation. The reason is that we don't have a lot of antioxidant defenses at the eye level. So when we're being exposed to increased amount of reactive oxygen species, things like nearsightedness or cataracts maturation can occur. How you receive the oxygen really affects that. Getting oxygen through the hood or in an oxygen pressurized chamber stimulates cataract maturation a lot more than getting oxygen through a nasal cannula or a mask that tightly fits to your face. Another two physiologic effects of hyperbaric therapy can become side effects if not being accounted for. So one is increased blood pressure. Hyperbaric oxygen therapy causes increase in blood pressure, both in normotensive, so somebody who has normal blood pressure, or hypertensive, somebody who has high blood pressure to start with. This increase is not a huge increase, maybe by 6 or 7 millimeters of mercury. So let's say I had blood pressure of 120/80 before I did my hyperbaric session. When I finish my hyperbaric session, my blood pressure would be somewhere between 126 to 128 by 82 or 83. And another physiologic effect of hyperbaric therapy is hypoglycemia. There is an increased utilization of glucose during a hyperbaric treatment. Mitochondria grabs, or cell grabs more glucose, sends it to mitochondria, so it can be utilized in oxidative phosphorylation with oxygen to create energy. In diabetic individuals, diabetic, not just anybody, that balance of keeping the right blood glucose level could be impaired somewhat. So let's say somebody goes in, they're diabetic, they go in inside a hyperbaric chamber, their body starts to utilize glucose, insulin sensitivity increases, and their blood glucose can drop because they cannot regulate it really well by producing glucose from other sources. The baseline that we'd like to see in diabetics before they go in a hyperbaric chamber of their glucose level is 100 milligrams per deciliter. If that's the case, if it's not lower than that, they should not experience any hypoglycemic effects in a hyperbaric chamber. And our last effect is claustrophobia. 2% of world's population are claustrophobic, which means that they are afraid of confined spaces, and it can produce anxiety. Of course, when somebody who is claustrophobic or who is prone to claustrophobia gets into hyperbaric chamber, especially if it's a monoplace hard shell chamber, they might experience claustrophobia. To avoid this situation, we need to take a proper history. So we need to ask that person who came to get their hyperbaric treatment, if they ever had claustrophobic effects, how did they deal with it. Then if we feel that there's somebody who is prone to getting that, there are really good tips that you can use, really good techniques to help a person get through this claustrophobic feeling. I have a great video on that as well. You can watch it to bring the anxiety down. And in my experience, almost everyone eventually, when we are taking our time with them and explaining that feeling of claustrophobic, should they feel claustrophobic inside a hyperbaric chamber, almost everybody can get over it, with a very, very small percentage of people not being able to use a hyperbaric chamber because of that. And maybe we should look for another therapy that will be more suitable. It's good to stay informed about the potential side effects to make sure what you're getting into and what can happen inside a hyperbaric chamber, but also understand that this therapy is very safe.